Hi, my name is Sonia Perdomo. I'm going to be presenting the skin assessment. The skin is a stratified structure with three different layers: epidermis, dermis, and hypodermis, and also the appendages. In the appendages, we're going to find the sebaceous glands, sweat glands, and also the hairs and nails. This is an important structure for our body since participating in different functions, like for example regulating the body temperature, formation of vitamin D, protection, wound healing, excretion of certain substances like lactic acid, urea, sweats, among others. So we're going to be performing the assessment for the skin, and there is two key components of the physical exam for the skin, that are the inspection and the observation. And any times that we find a lesion, we need to describe the specific characteristics for this lesion. For example, the shape, location, if it's an elevation or depression, the measure, etc. In order to describe these characteristics, we may use different equipments for the skin assessment, and I'm going to show you now. For example, I don't have it in person here, so I'm going to show you like pictures. We may have like a flexible ruler that should be clear and white. We also may use a dermatoscope, also a magnifying lens, or a flashlight with a transilluminator and a Woods lamp. The Woods lamp is very useful when you're going to differentiate hyperpigmented disorders from hypopigmented disorders. In order to perform the inspection, we need to have a good lighting, and also we need to keep in mind that the best tool that we can use is our power of observations and our eyes. So we're going to sweep the whole body, and I just want to clarify that since this is for a school environment, and this is and just for the purpose of this video, my patient will be fully dressed. But if you have a patient in a clinic or in a doctor's office or in a hospital, you're going to ask your patient to remove the clothes, put a gown on, and the way that you're going to be performing the assessment is you're going to exposure the area that you're going to be examining. When you finish with that part, you're going to cover that one, and then you're going to exposure the area that you're going to be examining, and that will include the genital area. So in the inspection, we're going to look for symmetry, for color of the skin. When we assess the color of the skin, we're going to be looking for some yellow coloration, like for example jaundice or carotinemia. The jaundice can be related to liver, pancreatic, or gallbladder diseases, and carotinemia may be related to individuals who are consuming high levels of beta-carotene foods like squash or carrots or sweet potatoes. So we can also check on the mucus like sclera, or on the under the tongue up to see. Can you put okay to see if there is any different coloration in the skin. But now I'm gonna start performing the assessment. Okay. Hi, Mr. Perez. My name is Sonia. I'll be conducting your physical exam today. It's my understanding that you came in for your annual checkup. Is that correct?
Yes.
Okay. May I have your full name, please?
Ramon Perez.
Okay, Ramon. We're going to be doing a physical exam for you, and I'm going to be starting with your skin. Is there any concern that you have related to your skin? Have you noticed any dryness, any new lesion, or any nevi that has changed lately in size, or any discharge, any wound that doesn't heal or something? No. How many hours a day are you exposed to the sun?
2 hours a day.
2 hours more or less. At what time of the day?
3 and after 4 p.m.
After 4 p.m. Have you changed your shampoo or any other products that you use? No. Do you have any history or family history of skin cancer?
No, I don't have family history of skin cancer.
Your parents are alive?
Yes.
Are they healthy?
My father, he has history for osteoarthritis, and my mother, she has history for asthma.
Okay. Do you use alcohol, drugs?
Social.
Social, the alcohol or the drugs?
No, social.
Alcohol?
Alcohol. Social.
Okay. Do you exercise regularly?
Every day.
Okay. Are you taking any medications right now?
No.
Okay. I'm gonna start looking at your skin, and I also gonna be palpating your skin. Is that okay with you?
Okay.
That is part of the assessment, okay?
Okay.
I'm gonna be looking now to see if there is any type of asymmetry. There is nothing here. There is no lesions. Usually we should check the scalp too, but one of my classmates will be describing the hair, and I know she's going to be covering that part, so I'm not going to be doing that now. So we're going to look carefully to see if there is any type of lesion or injury. There is nothing here. We also need to check if there is any type of bruises or hematoma that may indicate any blood disorder, or if it's an elderly patient, or even a child, if we see, or a woman, or we need to keep also in mind that we need to rule out abuse if there is any multiple bruise in different stages or something like that. So it is important to check on that too. As part of the inspection, we're gonna also check if the patient has an EVI that has changed lately. We need to keep keep that in mind and check regularly, because that may be a precancerous or cancerous lesion that may require further attention. In regards to palpation, we're going to be looking for any moisture, texture, temperature, turgor, and mobility in the skin. This is important because we're going to be looking first, we're going to palpate first to see if there is type of dryness in the skin. There is nothing here. There is nothing here. This is okay. There is nothing here in the face. There is no any type of dryness or anything like that. So when we palpate the skin, we also need to measure the temperature. We're going to be expecting that the skin is going to be warm, and to assess that, we're going to use the dorsal area of our hand, because that area is more sensitive to temperature. So we're going to be palpating here, and we're going to compare with the other side of the body to see if there is the same temperature in both sides. So it's normal. Another thing that is important in palpation is to assess the turgor and mobility of the skin. To do that, what we're going to do is we're going to pinch between the thumb and forefinger. We're going to pinch the skin, and we're going to release the skin. The normal situation is that the skin should go back to place immediately. If you see that the skin is the tin is there still when you release the skin, or go back to normal, but slowly, your patient may need fluids. Just keep in mind that when you have an elderly patient, the skin is different, and you should measure other things like urine output or saliva, other factors to evaluate if the patient is dehydrated or not. There is some normal variations that we can find when we are assessing the skin. I'm going to show some pictures, because he's on this patient I can't show anything because his exam is totally normal, but I'm going to show you some pictures about normal variations and abnormal variation that we can find when we're performing the skin assessment. One of them is this first variation, that is the pigmentary demarcation line over side end, and that's a normal finding. That is like a marker, a line that marks the difference between the hyperpigmented skin with lighted pigmented skin. Is more seen in people with dark skin, like black people or Japanese. The second picture is a benign nevi. So in that case, you can see the normal nevi is usually less than 6 millimeters. Is brown, the surface is flat, and the majority of them are harmless. But be careful with this, because we need to monitor the nevi for any changes in case that because they may develop a precancerous or cancerous lesion, but usually the majority of them are harmless. And also we can find the changes that are appropriate with the age, like for example, the infants that the skin is smoother, or adolescents where the skin, due to the hormones action, the skin is has like an oily appearance. And also we have the elderly people where the subcutaneous tissues is decreased, the hormones, sebaceous glands are decreased in function too, the sweating glands are also decreased, and the perspiration is also decreased. So we're gonna find a drier skin, and the drier skin in the elderly people. So those are normal findings that we can find. And also I'm going to show you 3 abnormal findings. The first one is the melanoma. I selected that one because that is a little skin cancer that may have different characteristics in the lesions. There is an acronym to use when you describe that type of lesions, and it's ABCDE. A is for asymmetry. The lesions are asymmetry. The borders are irregulars. The color, you can see that it's not the same all over the lesion. They may have shades of brown, black, red, white, or blue. The diameter is more than 6 millimeters. Also, for E, we're going to see evolution, that are the change in existing pigmented lesions in an asymmetric manner. The second image is the basal cell carcinoma, and this is the most common skin cancer. We have to look for any persistent sore or wound that has no heal. This lesion is a little bit different. It's a shiny nodule that is purely or translucent, that may be pink, red, or white, tan, black, or brown. It has elevated borders with a crossing indentation in the center. As it progresses, you will be seeing tiny blood vessels that may develop on the surface. The last lesions is the psoriasis. The psoriasis is a chronic disease, it's very frequent. And in that case, the lesion is a well-circumscribed dry silver scaling papules and plaques. The lesion is most commonly seen in back, buttocks, extensor surface of the extremities, and the scalp. There is some risk factors associated with these conditions. For example, for the first 2 that are the cancerous lesions, the exposure to the ultraviolet radiation, the high exposure to the sun, a personal or family history of a skin cancer, more in relative first-generation relatives. Also exposure to radiation like X-ray, some chemical products like arsenic or petroleum. Also a risk for this to develop the alterations. So for the psoriasis, there is a few high risks that you should be considered. Like the causes is unknown, but we know that there is some factors that can be related to the disease, like the stress, obesity, some infections like viral or fungus infection, smoking. Those are risk factors related to that. In this case, your exam is totally normal. I just want to remind you to please use sunscreen every time that you go outside with a minimum of 30 SPF. That's what is recommended. And do not sunbath. Also avoid any type of tanning boots. But other than that, your exam is normal. You look like a healthy man, and I hope that I can see you next year for your next physical exam. If you notice something abnormal, don't hesitate to call me or come to the office, okay?
Okay.
Well, thank you so much for your time, and I hope to see you next year.
Okay, thank you.
Bye.